First, let's consider the health problem, which we could also call the outcome. Whatever issue we're concerned about, how is it affecting health? In our example, the health problem is high rates of TB among healthcare workers. The primary cause of this problem, as we learned from Josephine, is that too few healthcare workers use personal protective equipment in the hospital. So they interact with patients with TB and become infected because they're not wearing a mask to protect themselves. If you imagine that you are a doctor, you can think of the health problem or outcome as the symptom that your patient is presenting. But before you can prescribe a treatment, you need to diagnose your patient's condition. The primary cause is the first step in that diagnosis. So, for example, you might have a patient complaining of pain, and you determine that the pain is caused by inflammation. But you still would not have enough information to treat your patient because you would need to diagnose the underlying cause of the inflammation. Does the patient have an infection, or is this an autoimmune reaction? Just as in medicine, in public health policy, we need to move from direct or primary cause to underlying root causes before we can recommend a solution. While most health outcomes have one or only a few primary causes, they typically have many root causes. We will be talking later about root causes in greater detail. For now, let's just look at a few root causes. Why is it that healthcare workers don't use PPE in hospitals? Well, first, maybe the budget for PPE is too low, and so not enough supplies are purchased by the government. Or, healthcare workers may not be fully trained on how to use PPE, so they are exposed to TB unintentionally. A third root cause might be challenges distributing PPE from the central medical supply to facilities, so the providers don't have PPE even if they wanted to use it. It's important to note that while many settings may experience a common health problem, the primary cause and root causes are setting specific. The causes of high rates of TB among healthcare workers may be different in different settings. Local data and evidence are critical for linking a policy problem to primary and root causes in a specific setting. So in our example, if we did not have local data to link the high burden of TB among healthcare workers to these root causes, we would not be able to propose appropriate policy options. Later in the module, we will talk more about how to identify root causes.